Hi everyone, welcome to Baby Bum Theory. My name is Asma, and today I'll be talking to you about crying, but specifically excessive crying in babies. So surprise, surprise, babies cry, and in fact worldwide it's been found that on an average up to the age of 6 weeks babies cry for up to 3 hours a day, and that is technically normal crying. It gets better, it drops to about an hour or up to 72 minutes per day for a baby who's 3 months old. So that's good. The message is that things get better. Typically, normal crying will be worse in the afternoon or towards the evening time. And the general causes are thought to be hunger, especially when there might be weight gain as an issue, and also being overtired or overstimulated. In fact, babies need quite a lot of sleep, especially when they're younger. A baby of up to 6 weeks of age will need about 16 hours of sleep in 24-hour period, and up to 3 months can need about 14 to 15 hours of sleep. And definitely being awake for more than about an hour and a half to 2 hours, they can start to get tired and grumpy. Now, sometimes this is a bit more excessive than this. In fact, it's been referred to as colic often. Essentially, when the crying is probably more than 3 hours, it is a different type of cry, higher pitched cry, and baby is often inconsolable, that whatever you're doing, you're not able to get baby to stop crying. Sometimes they even lift their legs up to their body, which might show that they're in pain, etc. Why does it happen? It's not really sure. I mean, it's been hypothesized that it could be that there is a stomach abnormality, maybe in the digestion, maybe in the way the bowel moves, or an issue with the bacterial imbalance in the bowel that leads to perhaps excess gas, and then this causes the crying. When should we worry about crying and colic specifically? So usually if it's a sudden onset of crying when baby was fine before, or there are other symptoms suggesting maybe an infection, so fever, it's probably less feeding, less intake, so dehydration could be a concern. If there's vomiting, diarrhea, maybe blood in the stool suggesting some kind of stomach issue going on, and definitely issues with weight gain and general activity of baby, general development of baby, then yes, please, absolutely they should be assessed by a doctor. So generally, how do we manage? How do we help baby during this time? How do we help parents during this time? So, I mean, I don't know about you, but it's so distressing to see babies cry, as your own baby cry for even a minute or a few minutes, let alone for hours. So it is important that you get your rest, get a break during the day, and during the crying periods as well, have family members on hand or someone on hand so that you can take a break for periods to avoid the primary carer getting overwhelmed. Other measures during the day is like you can look into your routine, making sure they're trying to nap, getting the environment calm, quiet. Swaddling, wrapping has been found to help, it's a bit controversial, especially very tight swaddling, but definitely can help calm baby. Carrying them in a baby carrier, changing the environment, so maybe going on a swing or going in a car, and definitely during feeds, especially after feeds, burping, taking the time to burp them, as well as perhaps keeping them upright for about 30 minutes can also help to ease any stomach discomfort that they could be having. In terms of medications or any evidence base behind these, the one that has been shown to make an effect is actually using probiotics, but only in those who are only breastfed and under the age of 3 months that has shown some benefit. Other common things which are used, such as herbal preparations, gripe water is the commonest one. It's not shown, it doesn't have an evidence base behind it, and in fact in some places there have been some harmful ingredients found in it, so try it with caution. Generally, another thing is simethicone or Infacol baby drops helping with colic. Again, people try them, it's lacking evidence, but it could help. Massaging baby's tummy, like I mentioned, also helps to get rid of this. And other things that you might see are different medications, so there really isn't any evidence base for those. Okay, so the main message is get some help, try and relax, things will improve. Okay, make sure there's nothing serious going on, and then sort of prepare for your evenings or afternoon, evenings as best as you can, and ask for help if you need to. Okay, thank you, bye bye.